Here's the definition, which we thought would be helpful for you guys about what is deaf-blindness. Because usually there's an assumption that that means that you can't see or hear anything. But typically that's not the case. What it means is it's a combined vision and hearing loss that limits kids' ability to get information from people and objects around them. So they may actually have a slight amount of residual hearing and slight amount of residual vision. It's just the impact of the two creates a need where they're limited with what they can access in their environment, the way that you and I can informally. Here are some of the major etiologies of deaf-blindness. There's so many reasons in which that a person could become deaf-blind, but here are some of the biggies for you guys to know about. Maybe it's a hereditary syndrome or disorder. It could be a prenatal condition or a postnatal condition, and those could be things like maybe, sadly, there was a lack of oxygen because of an umbilical cord during birth or something of that nature, or after there was trauma right after birth. Maybe there's something within their family history. It could be that the child experiences a traumatic brain injury, or that they could have trauma to their eye or ear, or be born extremely premature. So this next slide talks about the diversity of students with deaf-blindness. We just wanted to impart on to you all that approximately 90% of the children with deaf-blindness have one or more additional disability or health problems, which is really significant. And it's really hard for you all as Part C providers when wee ones are initially born. Sometimes parents have a lot of issues with just getting them medically stable enough to get them out of the hospital. And that means that sometimes these kids initially don't get diagnosed as being deaf-blind. But something to help keep in mind for you all is that if they have a vision issue or they have a hearing issue and they're wee ones, it would be a good protocol for you guys to just have your radar up to say maybe the other needs to be tested. So at NCDB, what we do is each state deafblind project is responsible for maintaining their own census. And then annually, we collect those numbers and create one national child count for the federal government to try to keep track of where the kids are located and how many are in each state. We do the count for kids birth through their 21st year. So we count kids until they turn 22. And then after we serve them, then they move on for their lifetime point of contact to regional representatives through Helen Keller National Center. So this just is a slide basically saying that that's what we do. We compile one national child count. And if you ever wanted to go and look at your state-specific numbers, or if you wanted to just explore about all the etiologies and things like that, that information can be found on the NCDB site. So this is a graphic that I think is pretty profound to show you how incredibly rare this combined vision and hearing loss is. So the big black circle is all the children birth through 21 in the United States, and then the smaller gray circle accounts for the kids in our nation that are receiving special education services, and then that tiny, tiny little dot that's yellow accounts for the children birth through 21 who experience deaf-blindness. So when you talk about how rare is this disability, this is a pretty interesting way to realize that it is really the low incidence of low incidence disabilities and extremely rare. And then we broke it down for you so that you could see kids birth through 2. And so the red circle is all the children in the United States birth through 2, which is a little over 11 million. The little pink circle is the kids receiving special education services, and then the teeny little white circle is the children birth through 2 with deaf-blindness, which is really only right now, according to our child count, 561 children. So it's such a small number. And this is some more data that we just thought would be really interesting for you guys to see. This is the national prevalence of kids birth through 21 based on their etiology, what created their deaf-blindness. And so as you can see on this slide, the largest number is based on hereditary syndromes, and then it goes down to all the other reasons that may be creating their deaf-blindness. So there's a fairly large number for prematurity, so that would be something for you guys to watch. A large number have postnatal issues and some have prenatal issues, so this gives you a sense. And then our next slide talks about Pennsylvania. We pulled the data just for your state so that you could see. And based on looking at this, you guys really aren't that far off from the national data in terms of what the main etiologies are, because you can see that hereditary syndromes still have a big impact, and also too, pre and postnatal have a pretty big impact on determining deaf-blindness for your students in Pennsylvania. So it is recommended that children with one diagnosed sensory impairment, hearing or vision, be evaluated in the other area. That's something that I mentioned to you guys earlier. So as Part C providers, that's going to be something really important for you to pay close attention to when you start serving any child, is that if you see that they have a pretty significant hearing impairment or vision impairment, it would be really important to encourage that a referral goes on for the folks to be seen by the other. The next slide talks about, now that we've seen on the slide earlier, that there's such a few number of kids that experience deaf-blindness, it's rare. But what that means is providers often have really limited experience working with these kiddos, and that because of that, a huge burden becomes placed on a parent to be able to inform service providers about the specific needs of their child.